going to talk about the MicroOptx beacon device. This is a microshunt that is shunting directly to the tear film, avoiding the episcleral venous system entirely. Because of that, we're able to engineer a very specific resistance into the flow channel to achieve a target intraocular pressure. The current device is designed to hit about a 10 to 12 millimeter intraocular pressure. We've got two human clinical studies going on, one in the US and one in Germany. The US study is studying really pretty bad off eyes. In fact, 6 out of the 7 are without light perception. The EU cohort is a refractory glaucoma patient population in our intended population. In terms of safety so far, we've got 11 patients out to beyond 12 months of follow-up, and everyone has at least 3 months follow-up so far. We've seen no device-related serious adverse events, no sight-threatening complications, including infections. We have seen a number of device blockages, either partial or complete occlusions, many of them temporary. 4 of them resulted in a device explant and reimplant. 2 of them were the result of a combined cataract procedure where pieces of the lens debris were temporarily occluding the flow channel. We had 1 with pigment issue, 2 with pigment, a pseudo PEX patient, and then 8 of them we think is probably fibrin. We've been able to look at a couple of those devices that have been explanted, and that's what it was. Despite that, we have seen the intraocular pressure reductions we've been looking for. Throughout most of the follow-up visits, it is right in that 10 to 12 millimeter range on average. See a little increase at 6 and 12 months. Those were specifically due to cases of plugging of the flow channel at the time of the follow-up visit. Here's some individual line item data. I should mention on this slide too, all the baseline measurements are fully medicated. Every follow-up visit, with the exception of 3 patients, are completely off all meds. These are the US patients' line item data representing the result at the last follow-up visit for that patient. You can see a second to the last column on the right. Our patients, green would indicate they're off all their medications. The far right column is the % reduction in IOP. You can see we've got 3 patients in this study that are not responding due to either partial or complete occlusions at the time of the follow-up visit. But the rest are doing pretty good with at least 50% reduction in IOP. This is the European patient population. 13 out of 15 are off all meds. Many of them you can see in the last visit column are out beyond 12 months. And we've got, on average, a 40% reduction in IOP. We're also shunting to the surface of the eye. We're having a nice effect on corneal health and wetness of the eye. At baseline, nearly 60% of patients were either moderate or severe dry eye based on the Schirmer tear test. By 6 months, we've completely normalized that in 80% of the patients. The image on the left is our current device. This is magnified 500 times. This is a rectangular flow channel, and you can see on kind of a nano scale a relative surface roughness on the flow channel. Also, with the rectangular flow channel, we don't have uniform shear stress of the laminar flow. And so we think that's actually causing the blockages, device occlusions that we've seen, where perhaps fibrin can grab onto some of this rough surface in the corners, and then it just sort of grows from there. On the right is a device we'll have available for human testing in December. And this is a round flow channel. You can see it's almost perfectly smooth based on laser confocal analysis. We're increasing the shear stress 20%, and that shear stress is uniform through the entire flow channel. So we're really excited to get that device in humans and see if it performs better. Coming soon, we've got our pivotal study in refractory patients. The ID is approved by FDA. This is a beacon study. We'll be evaluating safety and effectiveness in 90 patients, up to 15 sites in the US and Canada. Thank you.